Newsfirst Newsline with Faraz Shauketaly.
And a very good evening to you and welcome to Newsline Live. The fact that I'm wearing a mask, I think underscores everything that this program today is going to be all about. There is serious concern that the pandemic, COVID-19, has got almost out of hand. We have reports that hospitals, especially the wards that are treating people who are tested positive with COVID-19, are full. We have images of people in state hospitals who are lying on the floors in the corridors, under beds, and so on. So clearly the whole situation is very, very concerning. And to discuss this and a little bit more, this evening we've got with us Professor Indika Karunathilake, who is the immediate past president of the Sri Lanka Medical Association and is the vice president of the OPA. Very good evening to you, Professor, and welcome to Newsline Live.
Very good evening to Faraz, and a very good evening to all the viewers.
Thank you.
Thank you.
Now then, I'll just start with sort of tell members of the public how seriously we're taking everything here. We've got here a, I don't know if we go into a wide shot we can see it. We've got here a screen, a perspex screen. We are keeping our distance here with each other, with the guests, and of course the guest and I too am wearing my mask. We've been sanitized before with the hands and so on, and that's how seriously we're doing it. We're also broadcasting from a very special studio, purpose-built for, as a result of the pandemic, and it's in the car park, and it's a fully fledged studio. So, Professor, tell me, what is the current situation?
Yes, like you correctly mentioned, there are reasons for concern regarding the current situation. If you go by the information that is coming from the hospitals, especially the hospitals that are treating COVID patients and also the national hospitals, the number of admissions related to COVID infection is going high. And more than that, rather disturbing is the number of patients who need oxygen, the oxygen dependent patients. That number is going high. And also the number of deaths also seem to be gradually going upwards. And the rate of infection, the spreading, again seem to be higher. For example, if you take the number of positives compared to the number of tests done, regardless whether it's PCR or rapid antigen, it is also on the increase. So when you consider all these factors, I think we are looking at a rather serious situation. I think there's no denying that fact.
And Professor, are we doing enough testing?
Okay, a difficult question. I think we have discussed that previously also. Now, when you look at the positive rate, say when you do say 100 tests, how many are positive? At the moment, it is around say 15, 16, which is actually a high number. Again, the information that is coming from hospitals is when you do the rapid antigen testing, there's high chance, if you suspect the disease, there's very high chance that it is being positive, and it is very different to the previous situation. So that shows what does that tell? It tells us that if you do more testing, you might find more patients. So there may be more patients than what is actually reported. At the moment, around close upon 2,500 are reported daily, but there may be more than that, because if you take the country's situation, there's something what we call the testing capacity, the capacity of the country to test. At the moment, around 15,000 or 20,000 tests being done. Yes, correct. I mean, if we do more testing, yes, we can. However, there are certain issues like the delays in reporting, and also maybe the time taken for the report to come, all these things. That is, all these are due to the testing capacity of the country. However, I don't think we can increase the number of testing in a large scale, because what will happen is, if that testing, it goes beyond the country's capacity to report, then there will be delays. Then the whole purpose is less. So you have to really think about the testing capacity and test rationally, and also take public decisions based on that information and interpret them accordingly.
Now, whilst I hear what you say and take good note of it, there are some anomalies that I simply can't get my head around. And whilst the numbers seem to be going up, and whilst the death toll certainly is going up, around 60 I think yesterday, hovering around that mark every day. In between all this, we have certain, what I tend to view as an anomalous situation, and perhaps done a little bit too early. Namely, one, the return to work of the private sector. Now that has its own problems, because what about the public services? You know, are we going to see buses and trains full all over again? And then it negates all this business that I'm wearing a mask and you're wearing a mask and some people are, everybody's wearing masks, but they are packed like sardines in the trains and so on. And yes, they say that, look, we are going to take action, but how much of action can you take? That's one thing, you know, the return of the public sector to work. Secondly, I think yesterday or earlier today, we had the Director General of Health Services giving a letter saying that a big match can be held in Hambantota and so on. They may well be playing without the spectators and so on, but I think that the optics are wrong. The public are being told, you know, be careful, do this, do that, don't do this, don't do that, no gatherings and all this business, but then you're going to put about 25, 30 people out there, they're going to be playing a game. Really? During this time, is that what we want?
I think we have to really consider about the current serious situation. There may be many factors that determine the decision to maybe reopen the country and maybe ask workers to restart their work. There may be factors like, say, the socio-economic, financial, so on and so forth. But having said that, I mean, on one hand, you can't keep the country closed forever. You need
I
to
quite
restart.
agree. But,
yeah.
Professor, my point is this: we've got the vaccines now, which is brilliant news.
Correct.
You know,
correct.
well done, bravo.
Correct.
Excellent. Around 10 to 12%, closer to 12 actually, percent of the population have got vaccines. And that program is doing pretty well, thank you very much.
Correct.
The President himself went and had an inspection yesterday. All good. However, isn't it too early? Because, you know, these things have got to kick in 14 days and so on.
Correct, correct.
And secondly, the other point is that I wanted to ask you, Professor Indika, is this. With the first lot of the AstraZeneca, many people went for a long time, maybe sometimes over 3 months. So then they'd go and get their second dose. Isn't it like getting the first dose because it's such a big delay?
Okay, I'll start with your first question. Actually,
Yeah.
I was responding to your previous one also, which I'm also in agreement. True that there may be requirement to restart work and the services, so on and so forth. But at the same time, we have to really consider about the current situation. And we have been talking about this adapting to new normal. I think the country needs to be very serious about the new normal situation, because I don't really believe that we can go on blaming people, because people are human beings and they have been in this situation for long. So I think as a country, as a nation, all of us, say the administrators, professional bodies, professionals, we have a responsibility to show the correct pathway and what we call a new normal, how we can prevent the spread of the disease while adapting. While adapting the countries, is that definitely yes, but what you said, I fully agree. For example, very good example is, before reopening, one area that you need to really focus is transport. I suppose we have discussed that previously also.
Yes.
The transport has to be really worked out, because in the current situation, the way transport is happening, everything that was achieved by maybe the travel restrictions can be negated immediately within very short time, and maybe within next 2 to 3 weeks time we might see further increase. So yes, we need to really consider how to work out this plan, how we can think about the new normal, because the COVID is not going to go away in a hurry. Therefore, how we can adapt to the new normal situation, maybe even the work situation, even though people are asked to come, how the work arrangement can be made so that the number of the crowding is minimal and the work efficiency is maximum. So those arrangement has to be made. I suppose we had enough time actually. I mean, we started this last year, so there was enough time to have those mechanisms in working, or maybe working from home in an effective way, and get the transport systems in a proper way so that the chances for spreading is minimal. I think we have to think of those areas, and we have to really think hard about how we can adapt while preventing this issue.
Well, you see, this is my whole point, Professor. You speak about this this new normal, and it is new. And if it is to be the new normal, we can't be having decisions that are made apparently in haste. We have a call for the public sector to return to work, but the immunization or the vaccination program is just getting going now.
Yes.
We are only at 12%.
Yes.
Some people will tell me, because of the statement I'm making, saying that why should the Director General of Health Services give permission to have a big match or the big match, maybe without spectators, you know, whatever. And then they point to the Olympic Games in Japan. But I'd like to point out this, that the level of vaccination in Japan is just a touch under 31% of its very large population. So in Sri Lanka, there's no comparison. We're just about hovering at 12%. And even then, there are some doubts about the first lot of people who got the AstraZeneca. So, Professor, where do we draw a line? Are we doing this wrong? Because, you know, are we at the beginning of a very serious problem?
Okay, I mean, the answer is very complex. I mean, one thing we have to appreciate is the rate of vaccination, and the rate of picking up is actually, that is something that we can commend. Considering the limitations of vaccine supply that the country is facing, and other resistance and other issues, so on and so forth, the rate of vaccination picking up is very commendable. I think the credit should go to the health system and also the Triforces who have worked together for achievement. Having said that, I fully agree that what we have reached at the moment, 10%, even though very commendable, that is nowhere near the requirement to prevent the spread. It may be a good enough achievement to start with.
So at what level, at what percentage level of vaccinations of the whole population do we achieve what you people in your profession call the herd?
Okay, very, very important question. Okay, what do you mean by herd immunity is when a certain percentage of the community or the population get the immunity against a disease. It may be by getting the disease, or it may be by vaccination. When a certain percentage of the community get the disease, then it can stop the transmission chain, because those who haven't got the infection are covered by others who have got the immunity. That's what we call the herd immunity. However, the percentage that you need to achieve to get herd immunity is variable. If a disease is spreading very fast, then the percentage that you need to achieve herd immunity is also very high. So at the moment, COVID is spreading fast. So the percentage that you need to achieve the herd immunity for that amount may be more than 90%. So at the moment, even if we combine the total vaccination and those who have got the infection, we are not anywhere near the mark. So the current priority, because getting herd immunity through vaccination seems to be a distance far away target. The current priority may be perhaps to prevent the deaths and the serious illness by vaccination, by targeting on the target populations.
And Professor Indika, if you had your way,
yes,
would you say that it was the right time to get the public sector back into work, Or would you have waited perhaps another 2 or 3 weeks, maybe a month, so that the vaccination things can get going?
Okay, if it meant getting the public sector in a gradual way, identifying maybe like the high priority areas related to the economic sensitivity and the low risk and high economic areas like maybe the companies and trade zone, in a gradual way, yes. But overall opening up, I think better to reconsider. So
better to reconsider.
And also you need to consider other factors also. For example, you can identify the high yield, low risk areas and think of, say, other approaches like bio bubbles, so on and so forth, and make sure the transport and accommodation, those arrangements are also made in parallel.
All this takes time.
All this takes time. So, I mean, this should start long ago, because, I mean, we need to develop these systems, because you can't develop these systems overnight.
I get the feeling that these are sort of ad hoc decisions made on the go.
Yeah, I wouldn't use the word ad hoc, but I think because there are maybe multiple reasons that would determine this kind of decisions, like maybe the economic situation of the country and the current situation and the economy going down. All these factors may be playing role. Having said that, I think the other factors like the transport and the prevention, because prevention of the epidemic should be a priority. There's no doubt about that. So we have to work out a mechanism how we can prevent the spread while maintaining efficient services.
On that note, let's go for a short break, have a little peek at the headlines for this evening's primetime news. We'll see you on the other side.
News First, Newsline with Faraz, Shauketaly.
And welcome back to Newsline Live. I am in conversation with Professor Indika Karunathilake. And thank you for several questions. Everybody wondering why the mask. The mask is merely to reflect the seriousness of the situation that our dear beloved country is facing, from north to south, from east to west, from the hills to everywhere. The problem is serious, and which is why we've taken measures to take every possible precaution. And we've also got here Professor Indika Karunathilake. Tell me, is this the fourth wave?
Okay, very interesting question, because there are many organizations or even, say, authorities referring this to a fourth wave. Now, this concept of wave came up during the Spanish flu. That was in the 19th century, where initially there was a very high surge of infection, the numbers, it has gone down, and after 6 months, there was another higher surge. So after that, this where this concept of wave came up. Initial wave, then going down, no patients, then coming up. Having said that, this is a new virus. So we can't really make comparison with the Spanish flu in every time, because we are still learning. We still don't know many things about this one. Now we are talking about the Delta variant and the high contagious nature and more variant.
Is it highly contagious? Is that fact?
It seems to be highly contagious. Yeah, let's come into that also. Now about your question about fourth wave. Now in Sri Lanka, actually, this can be a misnomer. Why I am telling this a misnomer is, number one, Sri Lanka never really had a first wave actually. What happened in 2020 was, there were isolated clusters that were separated by time and location. For a wave, it has to go over time and over geographical locations. But here in 2020, if you look at that, the epidemiological curve, what you see is some clusters, and compared to the current situation, there are small clusters separated by time and the location. The real surge actually came around September, October, after the fish market and the what happens. So because of that, and then that surge gone up, and then later came down a little bit towards January, and after that it has become a surge. So that surge that started maybe around, say, April, during the New Year time, because of the maybe higher mobility and several other factors, it hasn't really completely gone under control. There was mobility restrictions, so on and so forth. Because of that, it has gone down. So when you look at the epidemiological curve, superficially, you see 4 waves. That's why this conception of 4th wave comes into play. However, it ignores the fact that the surge that has started in April hasn't completely gone under control. There was no the number of patients coming down to maybe close to 0. It hasn't happened. There was a dip, but that dip was due to multiple reasons, including the travel mobility restriction, and also there was one point that the number of testing also gone down. Due to that, the number was less. But we can't forget the fact that the reasons that has led to the current surge started way back around March, April. So what is really needed is, rather than trying to label in an oversimplified way, we have to really identify what were the reasons, where have we gone wrong, and then base public health decisions based on that.
And Professor, I find this question rather interesting, and it's worth, let's say, the economy is important, no issue, yes. But life is more important. Where do you draw the line?
No doubt about that. And I don't think we can justify even a single death, honestly speaking, because every death is preventable here. So I don't think it's a kind of balance in between the deaths and the infection and the economy. No, it should not be. I mean, first of all, we have to make sure that the infection and the epidemic is under control. Parallelly, of course, you can think about economic activities, but then there can be the stepwise approach where you identify the high yield and the low risk and making maximum measures to prevent the spread of the disease. Like I have mentioned previously, you need multiple measures, not only one, multiple measures. Legislation, vaccination, then the preventive measures, all these things comes into play.
You know, talking about how potent this new wave or the Delta variant could be, you know, we've got this perspex between us. Is it perfectly safe for us to remove our masks or not?
No, I don't think it's perfectly safe in this situation, regardless of the variant, regardless of the variants, because the variant, the virulence of the variant would depend on many factors. It is not just that they stay in there for longer time. That may be one reason, but there are many other factors, mainly like how fast can they attach to a particular cell in our respiratory tract. Because virus can only proliferate within human or the living cells. So the answer to your question, no, because both of us are actually in a confined space. And even though we have this thing, it is possible for our droplets to linger in the air for a while. So,
do we have any idea of how long this virus sort of lives? Is it in seconds? Is it a minute? Is it hours?
More than living, actually, more than living. Now, in the past, it was there was a lot of interest about the surfaces, but nowadays, more than the surface, the more interest is that it can be there in places where that is crowded and poorly ventilated, populated places with a confined area. Those are the most dangerous places. So here also we are in a confined place, but luckily only 3 of us. So in that way, that reduces the risk. The way we are speaking might increase the risk, but since we are wearing the mask, that reduces risk. So there are many
people who are saying that they can't see your facial expression or mine. Well, this is the new normal.
This is the new normal.
It's the new normal. What can we do?
Fully agree. This is the new normal. I mean, that we need to adapt. We need to adapt to those situations.
So, what do you suggest that people who are going into work now, they've been told to come back to work, and so on? What do you suggest? How do you suggest that they keep their distance and so on, bearing in mind the trains and the buses? You know, we are not this big Western developed economy. We are still struggling.
Fully agree. I mean, let's leave around the transport part, because I mean, at the moment we don't foresee a solution for that, even though it's a must. Yeah. So when you go to office, make sure that your office is well ventilated. For example, opening your windows is far better than having air conditioning. Always wear your mask. Always wear your mask when you are in the office. Very important. And hand sanitation, hygiene, again very important.
What about when we're having our meals?
Very good. That's the best question, because whenever, now in the past it is very pleasant to have meals with your friends and have a chat.
Yeah.
But not anymore. Whenever possible, don't go for meals together, because that is one instance. That is one instance where the spreading happens, because you have removed your mask and you are talking and the droplets can go out. So that's a very bad situation. So I think we have to adapt. So forget about going together for meals in confined
So forget
places.
about this Yuthukama and Ekutukama and all that business.
True.
Because normally, you'd find them sharing their meals.
Never.
So
I think we have to forget about that.
You got to forget about that.
Sharing meals, sharing cups is the worst thing that you can do.
Oh.
Sharing the drinking cups, the tea cups and so on. Maybe you can have your own cup. That would be a good idea in this situation. So the meal practices, please change. I think that's a very, because there are things that we cannot control. But at the same time, we have to do what we can control. So those are certain things. Definitely, taking meals, you have to be very careful.
Various people saying various things. We have a message from Kandy. We are in Kandy. When can we expect the second Sputnik dose?
All right, that's
Sputnik.
a very, very difficult question, very sensitive question to ask, because now Sputnik was given, and there was one consignment that came, and that was given to some districts actually. Now the country is not very sure when the second dose of Sputnik is coming, and sometimes there may be a possibility to go for a second vaccine in a different way. That all depends on the consignments that are coming, because there may be some problems or issues related to the second dose of Sputnik, because compared to other vaccines, now if you take AstraZeneca or Covishield, first dose and the second dose, the consistency is the same. But Sputnik is different. There are differences between.
Is it different by design?
By design.
Right.
By design. There can be different reasons for that.
Yeah.
By design it's different. So because of that, it is not like keeping some amount of the first consignment for the second dose. It doesn't work for Sputnik.
So the second one is completely different. It's not.
Not completely different, but there are some.
It's not the same as the first.
Not the same. The difference is with the viral vector where you used to get the vaccine into the body.
Right.
So that is where the difference comes in. So at the moment there are some issues related to that. So hopefully it may be sorted out. Or if it is not sorted out, maybe the country need to take a decision whether we have to go for a second dose in a different vaccine.
Are you aware of how many Sputnik doses have been given?
Not a very large number, I suppose. Right. I can't remember the exact number at the moment.
Okay.
Yeah.
At the end, as we come to the last minute, what do you say to, well, somebody's asking very quickly, how about buying food from bakers and so on?
Okay, there is not much evidence that the spread is by the food.
Right.
But the very act of going to crowded places.
Yeah.
And maybe the bakers also, they may or may not be following precautions. So that is the issue. The most important thing is avoiding crowded, poorly ventilated places. Now, for example, if the baker is coming to you, and then if it is not very crowded, and if it's an open space, then the risk is less. Always you have to remember, the highest risk are the places where they are poorly ventilated, confined, and poor hygiene with a lot of people.
Professor Indika Karunathilake, thank you very much for being on Newsline Live. It's now time for the primetime news, of course. And take care, thank you for watching, and as always, God bless you.